So today I'm going to be watching this video. It's called Australian Healthcare. As I mentioned, I have a young family. We currently live in Malaysia, but Australia is definitely somewhere we're considering moving to. We're still thinking about also possibly moving back to the UK, but we're just looking at different places and comparing at the moment. An important thing when you've got a young family is obviously the healthcare system in that country. Here in Malaysia, my wife and my children were born in Malaysia, so they get free healthcare, and it's a pretty good level of healthcare as well. I have to go private because I'm a foreigner, but if we move to the UK, NHS is a pretty good healthcare system. It's free, although I think the reputation has been going down over the last couple of years. But I'm really interested to know more about the Australian healthcare system. It's obviously very important when you've got a young family and considering a country to move to, what the healthcare system is like.
It's been a while since we've done an international healthcare system episode. We thought you might need a break. That break ends now. Australia has the only continental universal healthcare system, and it's the topic of this week's healthcare triage.
Continental universal healthcare system? Interesting.
Like pretty much every other country we've covered, save the United States, Australia has a universal healthcare system. It's called Medicare. What is the deal with that? Seriously, do none of these countries have a thesaurus or something? Medicare, Medicare, Medicare. Anyway, Australia's national public system provides coverage for citizens, permanent residents, and even many people with temporary visas. There's a program for visiting students, and even people seeking asylum get coverage while their cases are under review.
Wow, that is very fair actually. I don't think I've ever seen a country's healthcare system cover so many people. Of course, normally it'll be like citizens and permanent residents, but this one, even people with temporary visas, visiting students and asylum seekers. That, again, is that normal? I don't think that's normal. What do Australians think about that? I know that there's a certain section of people in the UK that would probably be unhappy that other people, visitors to the country, if you want to call them that, would be getting covered. They'll be like complaining about the strain on the system and so on. How do Australians feel about that? I guess it's, for me as an outsider, it's great that a country cares so much about anybody inside the country that they're willing to offer the healthcare system to that. But do Australians have a different opinion of that?
Get coverage while their cases are under review. Australia also has a voluntary private health insurance system which complements and supplements the public one. It can give citizens access to private hospitals and some services not covered by the public system.
Tell me if you
The tax system
use private
incentivizes
healthcare.
the purchase of private insurance for many individuals and families. Medicare also allows people to get free inpatient care in public hospitals, free access to most medical services, and prescription drugs. The federal government also works with more local governments to provide population health, mental health, some dental care, some physical therapy, and services.
Whoa, this actually sounds a lot more all-encompassing than the British healthcare system. I know that in Scotland and England we have slightly different things that are available, like for instance prescription drugs, I believe. I don't know if they still are, but I believe at a point they were free in Scotland, but in England you had to pay for them. The Australian system seems like it covers even things like dental care, mental health. I think this service for veterans as well, like that's actually great. Like I know that Australia does value its veterans very highly, things like Anzac Day and stuff like that. It really a country that is proud of their veterans and stuff. So I love to see this.
For veterans. Medicare pays for somewhere between 85% and 100% of outpatient services. It also pays for 75% of the medical fee schedule for private patients who use public hospitals. Whatever isn't covered must be paid for by patients. Doctors can charge whatever they want, although incentives are in place to make bulk billing more likely for the elderly, poor people, children, and people who live in rural areas. Members of those groups also get a discount on drugs. Their co-pays on prescriptions are around $5.90 Australian versus $36.10 for everyone else. There are out-of-pocket maximums. When an Australian is paid out $421.70, then Medicare covers 100% of the fee schedule for doctors for the rest of the year. When they reach $1,221.90, then 80% of all out-of-pocket costs are covered for the rest of the year. For people in the special groups I mentioned before, the threshold is lowered to $610.70. Yes, that's complicated. Thanks, Australia.
I don't think it's too complicated. I think it's very well structured, and I mean, if you compare it to somewhere like the US, where it sounds like he's from, like Americans must just look at that and think it's some sort of amazing system. It's absolutely brilliant, actually.
Also ways for families to pool such spending and to hit the limits faster. There are pharmaceutical subsidies for those who reach a threshold of $1,391 in a calendar year 2 for drugs. The threshold is also lower for those in the special groups at $354. Australia is one of the cheaper healthcare systems. At 8.9% of GDP, Medicare is paid for mostly from general taxes, patient fees, and a 1.5% levy on taxable income. In 2010 to 11, the government funded about 69% of spending, 43% at the federal level, and 26% from states and territories. The rest, or about 31% of healthcare spending, comes from non-government sources. About 18% is out-of-pocket spending, in co-pays or services not covered by insurance. Private health insurance accounted for about 8% of spending. About half of people have private insurance, which allows them more options in practitioners, hospitals, and care that they receive. Those who opt for private insurance before their 31st birthday get a reduction in premiums for the rest of their lives.
Wow, so it's like so incentivized. That's like, this seems very smartly constructed for the whole healthcare system. Like, I don't know why more countries wouldn't just look at this and use this as an example and implement like the exact same structure. Like you see when in any other business, when you see something that's successful, you just want to copy that. You should really just copy that idea and implement it in your own way. If more countries did this, they would probably have a happier population like the Australian people are. Tell me what you think about that as an Australian, and tell me how you think it's changed over time. Has it got better, got worse? Tell me what you think.
Each year, an Australian waits to start buying private insurance after they're 30 sees their rates go up 2% from a base rate, again, for as long as they live. Subsidies have been available to many Australians based on income since 1999. Most primary care doctors are self-employed and work in groups. About 8% of them are under contract with private agencies. Most work in a fee-for-service system. Most also get incentive payments for meeting standards set by the Royal Australian College of General Practitioners. In other words, they have a pay-for-performance system to try to improve quality. I know you watched that video, right? Patients can see any general practitioner they like. GPs do, however, need to refer them to specialists. Specialists also work on a fee-for-service basis, and many of them work in both the public and private parts of the system. After-hours care is available either from primary care docs themselves or from private companies set up among various practices. Grants are available from the government to run after-hours care. Hospitals come in all flavors. In 2011, about 55% were public, 23% were private day hospitals, and 21% were other types of private hospitals. Private hospitals come both in non-profit and for-profit types. Docs that work in public hospitals are usually salaried, although they can work in other reimbursement settings when seeing private patients. Long-term care is mostly provided by families, with some people getting subsidies to help with the expenses. Some homes or care centers are available for those who are very dependent on assistance. Support is both means-tested and dependence-tested. The majority of long-term care facilities are non-profit. About a third are private, for-profit, and about 10% are run by the government. Quality is generally measured and reported on by the Australian Commission on Safety and Quality in Healthcare. About 85% of general practices are accredited against standards. And, as I mentioned before, pay-for-performance systems are in place to encourage better care. Some healthcare organizations and professional boards also have quality improvement programs.
That's good as well. It's like already got this like system in place that is really beneficial to the people, but not only that, they like have these ongoing quality checks just to make sure that there's always a high standard of service. That's the problem I've heard from people in the UK, like people I know that still live there. They're always complaining about things like even just being able to get getting seen on the day by a GP. People are having to call for hours in the morning trying to get an appointment for that day. It can be almost impossible just to get that initial meeting with a GP to be checked. Tell me how things like that are. What's the actual process of just making a simple appointment in the morning? Is it easy to do that? Is there a lot of GP services? Again, things like that. How is these quality checks, have they actually kept the standard at a kind of a good standard, or is this guy just talking it up? Does it reflect in the actual real situation how these things go on?
All citizens and permanent residents can get a personally controlled electronic health record if they want it. A fairly large amount of infrastructure exists to make such records interoperable at many facilities across the continent. Costs are controlled in a number of ways. The market uses generic drugs to keep pharmaceutical spending down. Almost all brand name drugs are bulk purchased by the government, which can also control pricing. New drugs have to prove their cost effectiveness before they're bought. Public spending is under global budgets.
That is the opposite from the US anyway.
Drugs have to prove their cost effectiveness before they're bought. Public spending is under global budgets, but as with some other countries, this can lead to increased wait times for elective things. There are also broadly negotiated fees for many services. The knocks against the system will be familiar to those of you who are familiar with the series. Australia is worried about a shortage of professionals, but who isn't? In terms of quality, Australia sometimes comes behind some other countries we've discussed, but certainly beats others, like the US. The private overlay makes some people there concerned about a two-tiered system of care. It's interesting, though, that only about half of people opt for private insurance. Australia also has a disparities problem, with many indigenous populations having lower quality outcomes and poorer health than other citizens. But life expectancy is high, infant mortality is low, obesity is extremely low, and preventable deaths are rarer than a lot of other countries. And Australia does it for a reasonably small amount of money. In summary, Australia has a pretty robust public healthcare system with a private overlay that half of people use for better access and services. If that sounds familiar, it's because it's much like other systems we've talked about, including France.
It actually sounds great. I mean, again, as someone who's from the UK and proud of the NHS and the healthcare system in the UK, again, I've lived outside of the UK for the last 10 years, so I can't talk about the service is recently, but when I lived there it was pretty perfect. The Australian one just seems so much more, even more well organised and more beneficial to the people, easier to use, covers a lot more. I've got to say, just from this initial video, it looks like the Australian healthcare system is better than the British healthcare system and could be possibly one of the best, if not the best in the world. So tell me, as Australians, is that true? Is it the best? How do you feel about it? How does it compare to other healthcare systems that you know about, maybe if you've lived somewhere else? But yeah, very interesting video, and yeah, another tick on moving to Australia.